I think receiving the COVID-19 vaccine today is quite meaningful. As a frontline healthcare worker, we've gone through many months of relative anxiety. We feel protected with the PPE that we wear, but there's always a little bit of anxiety. And just like other vaccines, like the flu vaccine, this is probably the single best thing that we can do to protect ourselves and others. So for me personally, it's very meaningful. I'm also excited for my colleagues and everybody to get this vaccine as well. It's important for Children's Healthcare of Atlanta because I think Children's really looks out for its employees and to make sure that we have a safe work environment. And in the face of this pandemic, offering widespread immunization for SARS-CoV-2 is really probably the single most significant thing that the institution can do to help protect its employees.
Today?
It's very personal to me as a healthcare worker. Every time we go into a room, there's always that concern, especially when you know the patient is COVID positive, is this something that you're going to take home to your family? And then beyond that, just as a family member who has had COVID before and suffered, tremendous consequences from it, it makes my heart really happy to know that we're no longer just on the defense, but now we actually have something to fight back. Yeah, this is huge. I think, there's so little understanding we have of how the impact it has on kids in terms of being infected with COVID long term. And so the fact that we have a tool now that hopefully will get expanded down to kids, but we can start off by protecting the people that take care of these children. It's a huge impact, and I'm looking forward to brighter days after this.
I think getting the COVID vaccine is super important for the institution and for our country. To me, I think it marks a tremendous, basically a miracle of science. I think this is a novel vaccine. It's incredibly exciting science. And that we're rolling it out and getting it done here at Children's is super important. I think it's really important that we get it at Children's so that we can protect our staff and we can protect our patients. This is a huge step in that direction. There's been a lot of fear, there's been a lot of illness, and I think this is meaningful progress towards healing for our staff, for our patients, for our country. So it's going to be huge.